Hi, everybody.
Hi, how are you?
Thank you so much for joining us. Another exciting edition of Living at Your Highest Quality of Life with the doctors at Inspire Wellness. I'm Dr. Dan Neides.
And I'm Jessica Hutchins.
So hopefully you guys had a wonderful Memorial Day holiday weekend and you're ready to hit the ground running for the pathway to better health for you. And so we're here to support that. And again, really appreciate you taking the time to not only join us, but also for your recommendations on topics. So continue to please send that in. Anything you'd like to hear that could impact your well-being or your family's well-being, we're certainly open to your suggestions. So thank you very much. So today we wanted to talk about weight loss. And this seems to be a common theme for many people. A valid reason for people to come into the doctor and discuss ways that they can improve their overall health through weight loss. Over half of the adult population in the United States is overweight or obese.
And about a third of the children are.
So a third of the kids. So we definitely are impacted as a nation regarding our excess weight. And so we wanted to give you some ideas about things that you could be doing to help reverse that trend. So I think before we get into the nitty-gritty and into the very specifics about things that you can do, I thought that we could start by anecdotally hearing about an example of weight loss, and that would be me. So 2 years ago, I was 40 pounds heavier than I am now. About 2.5 years ago, 40 pounds heavier than I am now. And like many of you had tried different ways to lose weight. It's something that I had personally battled for most of my life, both as a child and as an adult. My weight was very cyclical. And we tend to see that pattern of, we peak and then we are able to get it to come down and then we rise and then fall. And so I'm very familiar with that pattern in my own self. But what I realized 2.5 years ago was rather than trying to look at the latest fad as an opportunity to lose weight, and I've tried so many of the different programs, including Jenny Craig and some of the Weight Watchers philosophy, and Atkins for sure was something that, and I did see success. I was able to move the needle, but the problem, like all of the diets and dietary fads is they're not necessarily sustainable, and that's really what makes the challenge long term, is that if you look at studies on weight loss, less than 10% of the people who lose weight are able to sustain that weight loss after 5 years. And so rather than being a statistic, I wanted to try to be able to figure out a way to sustain this. And so what I was able to do was look at what I was eating as it related to, was it inflammatory or not inflammatory, and do my very best to remove those foods which were inflammatory. But the most important thing that I did was removing sugars. I was exercising an hour a day, and what I thought was a healthier diet, but still not necessarily moving the needle. And so what I finally ultimately did was I was eating real food, but most importantly is I was taking the simple sugars or refined sugars out of the diet, and then I was able to see that weight absolutely just peel off.
And what was your favorite sugar?
Mike and Ike's. So yes, candy. So anything that you could get at the local drugstore counter as you're checking out, anything that was chewy was what I was after. So yes, Mike and Ike's were my go-to. But having been able to relieve myself of that addiction, and it takes about 30 days for your taste buds to change, you can relieve yourself of that craving. And then you begin to move the needle as it relates to weight loss. So that was my journey. I think we're going to kind of break that down for you guys and give you kind of step by step exactly what it is we're looking for when we're meeting with you in the office, and ways that we can help you on this path to sustain weight loss. So again, when we're talking about chronic disease, we keep coming back to the same three things that drive that in what we see in healthcare in the United States. It's inflammation, deficiencies of vitamins and minerals, and an inability to detoxify out what the body doesn't want to hold on to or doesn't need to hold on to. So I thought maybe we could start there and talk about the concept of inflammation and what drives that. And one thing that has stuck with me on my journey is that when the body is inflamed, you are in fat storage mode, not fat burning mode. So let me say that again. One of the critical pieces to sustained weight loss is going to be identifying and reversing any inflammation in the body, because when there is chronic inflammation, you are in fat storage mode, not fat burning mode, and won't lose weight. So can you talk more about those different categories and maybe start with inflammation and what we're looking for?
Mm-hmm. So inflammation, we get inflammation from a million different sources, right? Stress and increased cortisol, that brings on inflammation. Increased insulin goes along with inflammation, and the more sugars you eat, especially if you're genetically susceptible, the more insulin your pancreas produces and you develop insulin resistance. Inflammation comes from the fat cells themselves. It comes from the gut, like an overgrowth of yeast or bacteria or parasites or small intestinal bacterial overgrowth. A lot of different gram-negative bacteria produce a substance called lipopolysaccharide that's very inflammatory, especially if you have leaky gut. But basically, foods and toxins and stress, I think, are probably the biggest categories, of inflammation. And what happens with inflammation and toxin exposure and deficiencies in vitamins and minerals, all those three categories that we talk, again and again and again about every week, they impact hormones because everything's related in our body, right? So there's the HPA axis, which is the hypothalamic pituitary adrenal axis. There's your thyroid gland. There's estrogens, progesterones, testosterones, all the female, male hormones. And pretty much those are the most commonly recognized reasons why there's excess weight. Let me back up a second and say that extra weight is probably a really common reason people come to see us, but it's not necessarily our goal is for weight loss. Weight loss happens when everything's back in balance in your body. So if we can identify whatever is out of balance, then the weight is just going to end up, leveling off at where it's supposed to be. So it's a hard thing for people to understand when we're not completely targeting weight loss. We're saying, let's get your vitamins up, let's decrease your stress, let's fix your gut. And that all plays, a big part in getting your body back into balance. So the weight will just naturally be where it's supposed to be once you get the inflammatory chemicals out of your body. So the big hormone categories that we test for specifically, because sometimes testing is necessary, if you can't get to where you need to be at home trying to change your diet, live a clean life, take good supplements. But one of the more common things is thyroid. And we did a Facebook Live a few weeks ago on thyroid. So if you're worried at all about having low thyroid symptoms as a cause of weight retention, then please watch that. There's insulin too, which I mentioned before. So pre-diabetes is really, really common where you have high insulin or an insulin resistance. You have to pump out more insulin. So your cells recognize that, and the insulin itself is inflammatory. And then cortisol, which is the stress hormone. And then the high estrogens, which are really, really common these days. I feel a lot of it is because of the environmental estrogen exposures, things like bisphenol A in plastic water bottles that can make estrogen bind. And you can develop an estrogen dominance and get more of a pear-shaped obesity where it's in the butt and the thighs more than the stomach. The stomach obesity tends to be more of either high insulin or high cortisol, but often there's a mix of both, so you can't use that as a determining factor. But testing for all these things are important, and leptin as well. Leptin resistance, just like insulin resistance, is becoming more and more of a problem, and leptin can help control your gauge as to whether or not you're hungry and how much you eat, and the fat storage as well. So different tests, like for thyroid, for example, again, in the Facebook Live video, we went through all the blood tests for thyroid. For estrogens, we do saliva testing. We also do urine testing for estrogens because it's important how you metabolize estrogens. If you metabolize them into more dangerous substances, then they're going to be more likely to cause a problem, including obesity. Cortisol we measure in saliva and urine also. There's different times of the day where cortisol can be high or low, and sometimes when that's inversed or reversed, then that can cause inflammation and weight gain. So that's pretty much all about the hormones. So definitely hormones are a cause of not being able to lose weight, but remember that's usually not the root cause. There's usually something driving the hormonal imbalance, and the hormonal imbalance is more like a symptom saying, hey, wake up, we got to change something, or get things back into balance so we can function better.
So you don't normally test all hormone levels in patients who, if they come in and say that they're looking to lose weight? Or maybe I should ask, do you?
No. I mean, it definitely depends on their history. Sometimes, again, a patient will come in and pretty much tell us when things started and triggers and things like that, and when they all of a sudden gained a bunch of weight. So that can help gauge our testing. If somebody comes in and says, I'm so overwhelmed, I feel tired all the time, but my brain won't shut off, I can't sleep at night because I can't stop thinking, and I'm gaining all this weight around my midsection, and I don't even want to get out of bed because of all the decisions I make, just this constant overwhelm, well, then I'm going to go right to testing cortisol for sure. And if someone comes in and says they either have had breast cancer before, or have fibroids, or really heavy periods, or clearly look like a pear with the weight and the hips and the butt area, then I would look at estrogen metabolism testing more. And some people who have every single symptom of a thyroid problem, I would test for that. But more importantly than just those is getting to the foundational things of looking for nutrition too. So nutrition testing, we do a lot of nutrition testing. We use a test called NutriVal, which looks at a lot of vitamins and minerals. We also have been starting recently to use SpectraCell, which is a more longer term inside your cell look at the nutritional status. So you need nutrition to process out the inflammatory markers that are created by fat cells, to process out the toxins as well. So if you don't have that, you're not going to be able to get your body back into balance for sure. And another thing with nutrition, specifically the NutriVal, that looks at all your omega-3s, 6s, and 9s, and that kind of balance with the fatty acids and cholesterol. And if you don't have enough of the fatty acids and cholesterol, you're not going to make your hormones, because those are the building blocks for hormones. So I see people, especially who are on statin medicines, for example, just not be able to get their hormones in balance because they don't have the substrates to make that happen. So another area of testing is toxins, specifically in heavy metals. We probably all have an overwhelming load of toxic metals, but for some people it plays more of a part in obesity. And we find a lot of times that people fix everything else in their body, their nutrition, their gut, maybe their hormones too, but they still can't lose weight. They might feel better everywhere else. They don't have rashes or headaches or joint pain or fatigue, but they still can't lose the weight. And sometimes it's your body actually holding on to the weight on purpose, because a lot of the fat store, or the toxins store in the fat. Same with the animals, right? Fat, bone, brain.
Right.
So as you lose weight, you release a lot of those toxins into your bloodstream, and your body knows that that's not good for you if you're not able to process them out. So before you lose any weight at all aggressively, please make sure your detoxification pathways are working and your elimination pathways, such as eating, pooping, sweating, deep breathing, and all that stuff. Otherwise, you're going to redistribute the toxins and potentially get sicker and fatter.
Wow, so that sounds like the workup is very similar regardless of whether you're dealing with weight loss or you're dealing with some sort of an autoimmune issue. It still, folks, comes back to identifying if, and usually there is, inflammation, where it's coming from, what's the root cause, right? So that's a significant component of the workup. And then certainly identifying deficiencies. So that's, again, relevant for all of us, regardless of what we're dealing with. We have to give our body what it needs so that it can work on our behalf. We want it to be working smarter, not harder. And so by basically think of your storing of your vitamins and minerals like your gas tank. I mean, do you want to be making a cross-country trip on less than a quarter of a tank of gas, or do you want to start with a full tank and keep it full? And obviously, we want to be able to pull our body to be able to pull these really important vitamins and minerals whenever they need to. So keeping those stores very high. And then as far as detox is concerned, again, you're talking about metals, maybe potentially food substances that may be highly inflammatory that we don't need to be holding on to.
Or glyphosate, I didn't mention that, you mentioned last time.
So
pesticides.
The active ingredient in Roundup, it keeps coming back to us. It comes back full circle. Herbicides and pesticides acting as serious disruptors, these toxins can stay within the body and then, again, prevent us from being able to lose weight. You mentioned leptin. I thought, just so for clarification purposes, the role that sugar has on leptin. So doesn't excess sugar kind of inhibit that feedback loop? So that where I think about this is You go out to a restaurant in anywhere in the United States and they put down a plate of food in front of you that's big enough for 4 people. And I've been in this situation, think about a time where you were in this situation, looking at it going, there's no possible way I'm going to be able to finish this. And 25 minutes later, the next thing you know, the whole plate's gone, maybe even including the plate. But basically what happens, we're putting so much added sugar into our food, that's lighting up the pleasure center up here, telling us to do more of that behavior. And so that is having a negative impact on the hormone that's supposed to tell us to stop eating.
Right. When we eat a plate full of salmon or a big salad or even something really fatty, like an avocado, for example, we're not going to overeat most likely. There's something in our body that sends a signal that says, okay, we're full, stop eating. That same signal doesn't really happen when you eat a lot of processed carbs like sugar. So absolutely. I mean, it definitely does matter what you eat. And I don't know if we talked a lot about or calories at the beginning.
We did not.
Either. So let me just mention this too. A lot of people want to know specifically how many calories should I eat. I will never answer that question. Please don't count calories. It's not a sustainable way to lose weight. What happens on the day you decide to stop counting calories, right? And it's not about the calories. It's about the quality of food and the detoxification in your body. So please remember, there's lots of stuff you can do at home. Eat clean, eat foods that are not inflammatory for you, whether you figure that out with an elimination diet or doing some of our food sensitivity testing we have. Figure that out. Eat the things that don't inflame your body. Eat the things your body needs and get the toxins out. Manage your stress. And then things will come back in balance probably 80% of the time. And if that doesn't work for you, then we have plenty of testing where we can narrow down exactly what your deficiencies are, what your hormonal imbalances are. And some people do need some hormonal treatment, at least short term, while we're fixing the gut, while we're getting the nutritional status up, like thyroid medicine sometimes, for example. But don't get discouraged. Don't just accept it as being old or aging or, being menopausal or just having a stressful, life. There's always something you can do about it. And that's a sign to me that your body's out of balance if you're overweight. So not only for, not cosmetic reasons, but really to feel your best. That's just something you need to take care of for sure.
Well, great. Well, thank you very much for that wonderful insight. I know we're up against it. We're a couple minutes past a 1:45. So we just wanted to take the time to say thank you very much. And again, just to kind of recap again, we keep talking about inflammation, detoxification, and deficiencies, but it's also really important to remember it's not just about the food that you're eating, which is important. We want it to be real food, but exercise, managing stress, optimal sleep hygiene, and then loving kindness. These are just critical components to an optimal life. And so there is no magic book or a magic bullet that's going to help you lose weight. We do it the exact same way, whether we're looking at someone with an autoimmune condition or somebody's coming in that needs help losing weight. By doing it this way, we're able to get the body back in balance and then sustain the weight loss over time. It's not about gimmicks, it's about sustaining. So thank you so much for joining us. We will be back next Tuesday at 12:30 with another exciting edition of Living at Your Highest Quality of Life. I just want to remind you that it's your time to thrive. Let us inspire you. I'm Dr. Dan.
Dr. Jessica.
Have a great rest of the
Bye.
week, everybody.